Do you often feel unusually tired or restless? Perhaps you've noticed a rapid heartbeat or weight loss without trying. These could be signs of an overactive thyroid or hyperthyroidism. Hyperthyroidism is a condition where your thyroid, a butterfly-shaped gland in the neck, starts producing excess thyroid hormones. This gland might be small, but it's mighty, playing a pivotal role in the body's metabolism, growth, and development. But when it goes into overdrive, it can disrupt your body's normal functions. You might feel jittery, sweaty, or lose weight rapidly. It's like your body's engine is running on high gear all the time without a break. It can be quite a ride, but not the fun kind. But don't worry, it's not all doom and gloom. Knowledge is power, and understanding hyperthyroidism is the first step to managing it. Hyperthyroidism can present a range of symptoms, some of which may seem unrelated. This condition, characterized by an overactive thyroid, leads to various manifestations that can be mistaken for other health issues. One of the most common symptoms is fatigue. Despite ample rest, you might feel drained constantly. It's not the average tiredness, it's a state of unending weariness that persists regardless rest or caffeine intake. Another symptom is unexplained weight loss, which can be quite dramatic and isn't the result of diet or exercise. Then there is the symptom of a rapid or irregular heartbeat. You might experience your heart pounding at an unusual speed. Lastly, an increased appetite is another typical sign of hyperthyroidism. Despite losing weight, you might find yourself feeling perpetually hungry. It's a conflicting symptom, leaving you feeling baffled. Other potential signs are trembling hands, excessive sweating, frequent bowel movements, and trouble sleeping. These symptoms can often be confused with stress, anxiety, or the common flu. So, if you're experiencing any of these symptoms, don't ignore them as mere side effects of a hectic life. It's crucial to monitor your body and take note of any changes. If you're experiencing these symptoms, consider consulting with a healthcare provider. After all, your health is your wealth, and it's worth taking care of. There are several factors that can lead to an overactive thyroid. To decipher the enigma of hyperthyroidism, it's crucial to recognize its causes. A chief perpetrator is Graves' disease. This autoimmune disorder fools your immune system into attacking your thyroid, leading it to produce excess hormones. It can be compared to a car accelerating uncontrollably due to a jammed gas pedal. Another common cause is thyroiditis, inflammation of the thyroid gland, often resulting from a viral infection or autoimmune condition. The inflammation leads to a surge in hormone levels, like a dam breaking and flooding hormones into your bloodstream. The role of iodine is noteworthy. This essential trace element, when consumed excessively, can cause your thyroid to thrust into overdrive. It's the typical scenario of too much of a good thing. It's indiscriminate. It can affect anyone. But some people are more susceptible. Women, particularly those above 60, are more prone to developing this condition. Awareness is key, but remember, hyperthyroidism is not gender-biased. The cause of your hyperthyroidism serves as a roadmap for your treatment. If Graves' disease is the cause, medication or surgery might be suggested. If it's thyroiditis, often no treatment is required. Overconsumption of iodine? A diet adjustment might be necessary. The first step in dealing with hyperthyroidism is understanding its cause. The deeper your understanding, the more effectively you can manage your condition. Identifying the cause of your hyperthyroidism can help determine the best course of treatment. Diagnosing hyperthyroidism typically involves a series of tests. If you've been noticing symptoms that hint at hyperthyroidism, your medical practitioner may recommend a blood test. This measures levels of thyroid-stimulating hormone, TSH, and thyroxine, or T4. High T4 and low TSH levels could point towards an overactive thyroid. However, blood tests are not the sole diagnostic tool. At times, they may also recommend an imaging test. An ultrasound of the thyroid can help identify nodules or inflammation that might be causing the gland to overproduce thyroid hormone. Another test could be the radioactive iodine uptake test, involving ingestion of a small amount of radioactive iodine absorbed by the thyroid. A special camera captures images of your thyroid gland, signifying how much iodine has been absorbed. These tests are important, but not definitive. Your doctor will consider your symptoms and medical history for a correct diagnosis. It's crucial to seek medical help if you're experiencing symptoms. The sooner hyperthyroidism is diagnosed, the sooner treatment can begin. Early diagnosis can lead to more effective management of hyperthyroidism. While hyperthyroidism can be serious if left untreated, there are several ways to manage the condition. It's crucial to understand that everyone's experience with hyperthyroidism is distinct. Thus, tailoring a management plan to an individual's specific needs is essential, and a healthcare provider plays a crucial in it. Let's discuss lifestyle modifications. These changes may seem minor, but they can significantly impact symptom management. Regular physical activity can enhance your energy, but remember not to overexert. A balanced diet is also vital. Consuming sufficient calcium and vitamin D helps maintain bone health, often affected by hyperthyroidism. Stress reduction is a vital aspect. This can be through mindfulness, yoga, or merely setting aside some time each day. It's more about finding stress coping mechanisms that suit you than eradicating stress completely. Now, on to medications. Various drugs can help control hyperthyroidism by reducing thyroid hormone production or blocking their effect. These comprise antithyroid medications, beta blockers, and iodine solutions. Be aware that these drugs may have side effects and should be closely supervised by your healthcare provider. In some cases, surgical treatments may be necessary. The most prevalent is a thyroidectomy, wherein all or part of thyroid gland is excised. This is typically for severe cases, large goiters, or when medications aren't effective or can't be used. Post-surgery, most will need to take thyroid hormone replacement medication lifelong. Another option is radioactive iodine therapy, which damages or kills the thyroid cells, reducing thyroid hormone. It's highly effective, but like surgery, most will need a thyroid hormone replacement medication afterwards. Regardless of the chosen path for managing hyperthyroidism, regular medical checkups are necessary. Your healthcare provider can monitor your progress, adjust treatments, and provide support. With proper management, people with hyperthyroidism can lead healthy, normal lives. It may require trial and error to find your balance, but with patience and perseverance, you can manage this effectively. Living with hyperthyroidism can be challenging, but you're not alone. This journey, like any other, begins with a single step. If you suspect you might be experiencing the symptoms we've discussed, don't hesitate to seek medical advice. Your healthcare provider is your ally in this journey, equipped to provide you with the tools and guidance you need. Self-care is crucial. Eating well, staying active, and taking time for relaxation can work wonders for your overall well-being. Every challenge is an opportunity for growth and learning. You're stronger than you think, and you have the power to manage your health effectively. Remember, your health is in your hands. Stay informed, stay proactive, and stay healthy.